Hi, my name is Maya. I'm an athletic therapist here at Revival Therapeutics and Performance. So EDS, or also Ehlers-Danlos Syndrome, is a syndrome that affects the connective tissues in your body. Connective tissue in your body is anything that supports your body, like your tendons, your ligaments, your cartilage, anything that is used to stabilize your joints. And people with EDS, what is going on is that their connective tissue has more laxity. So they feel like they can move their joints a lot farther, possibly dislocate or pop them in and out, or just hyper stretch them. And that can come with a lot of troubles as well, because your joints aren't stabilizing themselves and they're not supporting themselves. So your muscles have to kick in and do the stabilizing, which means overworking and over-engaging, which leads to load issues and can lead to constant pain and mechanical issues when you're doing different movements. Some of the most common symptoms with EDS are chronic pain in the joints, strains, sprains of different ligaments and tendons, subluxations or dislocations of any joints in the body, kind of shearing or overuse with just doing basic movements like brushing your teeth, brushing your hair, showering, feeling unstable or unbalanced are a lot of common symptoms. And then there is also the other side of like dizziness, nausea, having trouble with bowel or gut troubles. There are also feeling lightheaded, migraines and headaches. All of those are also very common symptoms of EDS as well. With hypermobility, the reason why it can cause chronic pain or pain over time is because when a joint goes past the joint range it's supposed to be in, the muscles then have to overwork to keep the stability because the connective tissue is no longer creating the stability. So the muscles have to overwork to do their job and keep your joints safe and in position. But if they're constantly doing that every single day with every single movement you do or not do, sometimes just having to sit upright and just sit or lay down, your muscles still have to engage if the connective tissue isn't doing their job. And your muscles aren't built to be contracted 24/7 every single day. So they fatigue, and then other muscles have to kick in to support when that's not their job either. So your whole body, all of your muscles are trying to work together to just stabilize your body and stabilize your joints together. But when they're overworking and they're doing too much, that is when injury occurs, because your muscles can only do so much for your body. And when they're doing a job they're not supposed to be doing, they can't do it in the best way because that's not what they were made for. So when there's more elasticity and there's more mobility in the body, your muscles have to jump in and do the job instead. And then they're not in a condition to do their own job of just being a muscle and creating strength and creating force. And so force doesn't attenuate and move through your body as well, which can create injury and overuse. The big thing with a client with EDS is more is not better with an EDS client. Most of the time, the stability and the tension and the tightness that they're feeling from their muscles and just feeling really tight and restricted is actually coming from the muscles just trying to stabilize their body and hold them together. But if you remove that tension and you remove all of it, their body no longer has stability. So it feels like jello and there's too much immobilizing. The body is moving too much, which still isn't okay. So what's key with it is making sure that, especially with someone with Ehlers-Danlos or suspected hypermobility, is you don't do the same to one side that you are going to do to the other side. You want to make sure the body is balanced on both sides. So you're not going to release all of the tension because you take away all of their stability. You can take away a little bit to even both sides out so that they're evenly distributed and there aren't imbalances. But we don't want to take all of that tension away because they won't have the stability to function. And then the big thing is, if you're going to remove some of that tension away, you want to engage it afterwards so it can see that everything is in place and you're okay, everything is stable and in line, so that those changes stay, they don't immediately pull back into that dysfunction that you're trying to fix. So the big thing with athletic therapy is we focus on your movement quality and your strength and making sure your proper muscles are being engaged and being stimulated during the right movement. I find a lot of the times with my EDS clients is what would be classified as like your stage 1 exercise is still way too complex for an EDS body. They'll be engaging the completely wrong muscles for the exercise. And I find once you get with athletic therapy, with a proper assessment and a proper body assessment of your mechanics and walking through the exercises, you get to see, and I can see what muscles are being engaged during the movement, and I can see when it's not the correct ones, and I can change the exercise based off the body in front of me so that you are engaging the right muscle, and we can build that muscle back up so that your body no longer has to compensate with those other muscles. And then we take that layer and we slowly build on that with the engagement and the strength so that you can do your daily functions without being in constant pain, and you can go about your day. And our whole goal is so that you don't have to rely on our appointments and your treatments to be pain-free. We want to train you and train your body to be able to support you on your own. Here at Revival, we have a lot of options for treatment for people with EDS to get relief. Some of them with myself, like I said, getting a proper mechanic and body assessment is huge to see which muscles are not doing their job in the team of your body and which ones are slacking and which ones are overworking. Being able to analyze that and see that is the big picture, and being able to educate you on the little things you're doing throughout your day that might be hindering, like that party trick that you have of hyperextending, or like being able to touch your toes from behind or dislocating your shoulder. Like those party tricks can be hindering you, and being able just to educate on things you're doing throughout your day that might be making things worse that you never knew, and being able to show you like how you can go about your day and go about the rest of your life with a lot less pain, because you shouldn't have to go about your life and change your life because of the pain you're going through every day. And there are also a lot of other little things like how electrolytes can benefit you if you have EDS, and little things and from a nutrition standpoint that can support you as well, that we'll talk about in our appointments and moving forward. And a lot of the other therapists as well are trained to analyze, and we work as a team to support each other from a gut health perspective and a education perspective and exercise perspective, as well as our massage therapists can support from the headache and migraine and a lot of the cranial work that comes with EDS as well. Proprioception is super important when it comes to clients with EDS because their neuromuscular connection, so their nerves or brain to body connection, is usually weaker. So it's really important to engage and bring proprioception into their therapy so that the brain and the muscles can reconnect and understand where their joints are in space, because that's a big part of it, is when you're overusing those joints and you're hyperextending those joints, they don't understand where they are in space because they're not where they should be. And using those training can help your body to re-engage and re-understand like where it is and where it's supposed to be. And that'll help a lot with the balance perspective, with the strength perspective, and making sure in the range of motion and making sure that your body can engage the correct muscles to do the exercises and just your daily functions. With EDS, the big thing is wherever you decide to go for support is that you need to have partially a manual portion, but it's also really important that you have corrective exercise approach to your care, because without that, your body needs to be taught how to properly stabilize your joints, or you're not going to find that long-term relief and you're going to have to rely on other tips and tricks. And I want everyone who's watching the video or potentially suspecting they have EDS or hypermobility that there is a way for you to live your life without being in constant pain, and you shouldn't be in constant pain. Nobody should be living in constant pain or in pain at all. If you're in pain, there is something that's going on that needs to be addressed from a mechanics perspective or another. But when it comes to EDS, it's hard to find potentially people to support you who understand what you're going through. And I want you guys to know that at Revival, we do understand the struggle that comes with EDS, and we're here to support you if you need it. If you do suspect you have EDS, hypermobility, or you have been officially diagnosed with it, it is so important that you share that with your therapist or practitioner you're working with anywhere, because without knowing that and understand or coming into the appointment, if the therapist doesn't know that, they're going to approach your body without that extra care that is needed with EDS. They're going to go and potentially try to release everything and not focus on that engagement or that strengthening perspective. And then potentially you're going to come out feeling worse than you did coming in, because not necessarily because of anything the therapist did, but because they didn't go in with the right mindset and the right lens to approach your body, because your body is working differently than the regular body. And without that information, it'll be a lot more difficult for you to get the care you need in that appointment. And it's so important that you have a clinician who understands what you're going through and understands the extra care that is needed with your treatment and moving forward.